Hello. Thank you. Number 3. This 10-year-old patient was referred to me for endodontic treatment of tooth number 3. As you can see, tooth is pretty bummed out. Large decay approximating the dental pulp, and patient had all the signs and symptoms of irreversible pulpitis. I'm often asked, why don't you just extract this tooth and then orthodontically wait until tooth number 2 is erupted and then orthodontically move tooth number 2 to the position of tooth number 3? First of all, I'm an endodontist. I'm not a general dentist. I'm not an orthodontist. So that decision is not my decision to make, and I can't recommend something that I don't know much about. So I present that option to the patient's parents, for example, and I leave it up to the patient's parents and patient's general dentist, and if they want to involve an orthodontist, so be it. I highly recommend that they involve an orthodontist. So that's what I always do. I present the case. I say, this is what we have. That is a possibility. It's a possibility. It's not a for sure thing. That's a possibility. What if tooth number 2 comes in and ends up the same way as tooth number 3? What do you do then? So, to me, it makes no sense to extract tooth number 3 and hope that tooth number 2 can, when it comes in and is healthy and is good and can be brought forward to the position of tooth number 3 orthodontically. To me, that option makes really no sense. If we have to go that route, if this tooth is truly hopeless, then yes, I understand. Hopeless meaning that there's nothing left of the tooth. But a tooth like this, in my opinion, is very salvageable. So always remember that. And here's the post-op, so take a look. Everything went beautifully. Removed the decay, rebuilt that distal wall there with composite, 4 canal systems, MB1, MB2, distal buccal and palatal. Tons of anatomy here, there, that beautiful lateral there. As you can see, everything went great. The apical diameter of the palatal canal was over 50, so I placed MTA here, left space for a post, temporized the tooth. Excellent.